Hello, it's Kevin Lawrence here, also known as Coach Kevin, and I'm actually really happy to be here today with one of our awesome new advisors, Laurie Ballantyne. Welcome, Laurie. How are you doing today?
I'm doing great. How are you?
Cool. Well, we're going to talk about like the super exciting topic of vaccination policies. Policies are sometimes challenging at the best of times, but this one it's a doozy. It's controversial in our world because it's important from a business perspective and a personal perspective. And it's hard to know what to do. So, as a bit of background, I've known Laurie for many years. She was a senior HR leader all of her career. And we had the great fortune to work together in the past at a previous company she was at before she started consulting. And then a few years after she was consulting, we were able to persuade her to join us here at Lawrence & Co. So it's exciting to have her on the team. It's awesome when you work with great people and then you get to work with them in a different environment. So, Laurie and I had this conversation about, you're talking about how you're helping a lot of people do these policies and getting them sorted out, but there's actually a lot more to it than meets the eye. And I know myself, with my clients, I've been in conversations trying to figure out how do we deal with this vaccine? And there's a lot of different beliefs. It's actually, a very polarizing issue and but a critical issue. And some people are pushing ahead with 100% vaccination. Lots of government agencies not doing it. Some people want to give people complete choice, but then take different precautions. And others are kind of playing the wait and see game and let the government decide. So we're not here to tell you what to do because we don't know what's right for you, but it's a complex issue and wanted to share, some of Laurie's insights about the mistakes that she sees people making as she's helping them to develop these policies in their companies. So Laurie, why don't you kind of share, the biggest things that you're seeing that people have great intentions, but it turns out not working out so well?
Absolutely. I think the first place that I'm seeing the most significant errors is, leadership team or an owner puts their mind to what they believe the policy should be and just rams it out. And then next thing you know, they have an oh shit moment because they didn't really think about the consequences of what that decision was on what that policy was and the impact it would have. And so they put it out there and then things change or people leave or they didn't contemplate certain aspects that needed to be included in the policy and it goes sideways on them.
So what would be some of those things that would be because they're just pushing it ahead that they're missing?
Sure. So the question is, are they really prepared to deal with consequences? So if you put it out there that you have, mandatory vaccine, that you require your employees to be vaccinated as now a condition of employment, essentially, top performer, you had no idea they weren't vaccinated and they say, no, not complying. And because you've done an all or nothing policy, no choice. Are you severancing them out? Are they quitting? But now you're losing someone who might have been key to your team. Mm-hmm. And was there a way to avoid that by at least doing a little more due diligence before ramming out the policy?
Yeah, and I've seen things too where people actually medically cannot get the vaccine. It's not just someone doesn't want to. I've got a good friend and colleague, and she can't because previous vaccines have really destroyed her health. So that's a good one. So the first one, so basically rolling ahead without thinking about all those consequences, and there's lots of different situations. What would be the next thing that you see people, the mistake you see people doing? And again, these are good people who just lost in not having to do this before.
Yeah. So the next thing I usually see is where an employer says, this policy, this is too much for me. I'm not comfortable deciding what's right for my organization or what I think is right for my organization. And so I'm just not going to do anything. And I'm just going to hope that the public health restrictions or regulations that are in place do the trick. And they have an outbreak or they have someone test positive. They don't have plans in place how to handle that. And the next thing you know, you've got an employee filing a complaint with occupational health and safety, WorkSafe, whatever your governing body is, that you have not fulfilled your obligation as an employer to provide a safe work environment for your employees. So by not remembering that obligation or not taking that obligation seriously, you can actually get yourself into quite a bit of hot water.
And are there specific things that companies need to do beyond you should just wear a mask at work or other things? Are there other things that need to be considered?
Well, I think it really sort of comes down to how far does the employer obligation go as required to provide a safe and work environment, protect their employees, and the expectation that you'll do whatever is reasonable, and reasonable is where the definition gets hard to come. Mm-hmm. What is reasonable? So is there proper social distancing? Do you have the right barriers in place? Are people being consistent and compliant in wearing masks when they're supposed to? Are they, protecting themselves from prolonged unmasked contact? So for example, at an employer that sort of follows the public mandates that are being mandated by the province, however, they're not really great at reinforcing habits in the work environment. And sure enough, someone tested positive and there were a number of direct contacts. And next thing you know, we're sending a whole bunch of people home to self-isolate. And oh geez, perhaps we should have put a little more due diligence in at the beginning.
Yep, that's something I've seen. Actually, I was in a meeting with one of my clients, and then we're sitting in the room, and then the HR person's peering through the window, just making sure that we're all following it, because sometimes the senior leaders can be the worst at it. But basically sticking to it, and especially after a period of time, continuing to reinforce it. Yeah. So basically that's that second. So forgetting this, go ahead.
Well, I just want to say the other side of this is there are people, or a lot of organizations, a lot of leaders, a lot of people think that the unvaccinated people are the risks. And what you need to remember is you're developing a COVID vaccine policy, is that this is also about protecting the unvaccinated. And so we tend to get a little bit loose in following the guidelines or the restrictions when we're vaccinated, because we feel like we've got a little bit of an armor on.
Sure.
And what happens is we're then actually putting those individuals that are unvaccinated for a variety of reasons at further risk as well.
Yeah, that's good. Lots of companies have talked about having, if you're not vaccinated, testing for people that are coming into the office that aren't vaccinated. But, for those that are, we can still carry it. And that's the thing. I'm not smart enough and don't understand the science enough to know how you should handle those things, but there's risks both ways. Okay, sure. Let's go to the next. What's the fourth or the third biggest mistake that you're seeing, or common mistake you're seeing?
Well, and whether it's a mistake or it's just not being contemplated at the time that a policy is being developed, is what's the logistics of handling whatever you put in that policy, and then what's the financial cost of it? So let's say you're going to provide an accommodation to your unvaccinated employees for regular testing, that you'll accept regular testing. Well, what kind of tests? PCR, rapid antigen tests, self-administered rapid tests? Who pays for that? Who monitors it? And I don't know the regulations to a T in all the provinces, but for example, where I'm from, if you get a pack of rapid tests from the government or through a pharmacy through the government program, you actually have to record the serial number of the test, person who took it, the date it was taken, and the test results. When that box of tests is empty, you have to take that piece of paper with all that data back to the pharmacy and trade it in for a new box. Jeez. And now, if you have someone who tests positive, you've got to report that right away. So who's doing that? Who is holding that responsibility of now handing out these tests, making sure they're administered properly, providing the space in your work environment that these tests are going to be done, and then doing all of this administrative data or data collection to fulfill your requirement under the tests? It takes time and energy and effort. And what I find is lots of times it's like, oh, we'll just get someone in the office to do it. And it usually goes to some poor administrative person.
Usually HR is a great department.
Or HR. Yeah. And then it's like, well, who wants that job? And is that a reasonable ask of that person? And are you putting them at risk by having them continually engage and interact in this way with employees?
Yep.
These are things you got to think about.
Yep. There's a lot of, and when you're in a boardroom making these decisions, there's a lot of repercussions that you don't think about because there's a lot of things involved.
Yeah, for sure.
Awesome. What's the next one?
Well, I actually think this is probably one of the bigger ones, is underestimating the impact that this has on the employees themselves from a mental health and a response to a policy, that it can be far more upsetting and divisive in your work environment than you anticipate. You end up with people who are not necessarily sympathetic to others' reasons or are whys in terms of being vaccinated or not being vaccinated. And, you cause a lot of personal anxiety and concern for certain people, whether or not they're safe in the work environment, or whether or not they're going to lose their job because they're not vaccinated, or whether or not there's going to be accommodations that are going to allow them to keep working remotely or in the office or whatever that looks like. And so a great example, and this was today, an employer that I've been working with, they communicated a few weeks ago that they were working on this. They asked employees to self-declare whether or not they were vaccinated, and said they would be rolling out a policy the week of the 8th. Well, that's today. Well, the phone rang today, 8 o'clock this morning, from one employee saying, "Is the policy coming out today?" And it was like, well, we're just finishing the fine tuning. We're figuring out all those logistics that are taking time to sort out. Why? And this employee has lost sleep. She is so anxious over the rollout of this policy. She's losing sleep. She's having trouble focusing at work, and it's having a real significant impact on her mental health. And I guess at the time that they said it would come out the week of the 8th, they didn't anticipate, and I would say I didn't anticipate either, the anxiety that this was creating for certain employees waiting to know what's happened. On the same note, we're doing some recruitment, and as we're recruiting, we had indicated that it would be a condition of employment that people would provide proof of vaccine. Now, can do that with new hires, trickier situation with existing employees. We had one candidate ask specifically what the policy was, and we communicated that it would be finalized this week. And the candidate asked to be put on hold and withdraw from the interview process until she knew what the policy was, because she couldn't handle the pressure, the anxiety of worrying about whether or not she would potentially miss or not get this employment opportunity if she was vaccinated or not. Like, it was that significant of an issue for her. And that is where people are really underestimating how significant, for lack of a better descriptor, how difficult this is and the extreme responses that can happen.
It is. And it's almost like if there's 100% of the population, the 10% on the two extreme ends of this, the conversations are intense. They're like, it's violating their beliefs. Even one organization I know now is making part of their policy, you're not allowed to discuss COVID and vaccination. And again, we're not here to tell you what you should do, but they don't even want people talking about it because it's such a polarizing issue, or it's just so deep and concerning one way or the other for some people.
Well, and I find when I have to have this discussion with a leadership team, I have to set the expectation right at the beginning that we are not here to debate sides of this, and we are not here to change anybody's mind. It ain't going to happen.
Yep.
So don't even think about that. What is the policy that you need to have to provide the proper protections for both your vaccinated and unvaccinated employees?
Yep. To
try and provide a safe work environment.
Yeah. And psychological safety in terms of their own mental health, because it is a massive issue for some people. Okay, let's get to the last one.
Okay. So the other issue is that there's not enough planning put in place about communicating out what this policy is going to be. What is the communication strategy that needs to be there to ensure?
Don't you just send a memo?
Exactly. An email. Just send an email.
Yeah, exactly.
It's no big deal. That is grossly missed. And we know how important communication is in the work part. We know how important communication is, period, bottom line. This is a situation where you have to plan and go way above and beyond what you think is going to be necessary. Who is the dedicated team on your leadership group within your employees that are going to be there to answer questions, provide support, kind of just deal with all of the responses that you're going to get, and all the way through from kind of telling people it's coming right through to implementation, and then on an ongoing basis afterwards.
Yeah, I can see that. And that gets underestimated a lot in different environments because people are so busy doing what they're doing. They've spent lots of time thinking about it, and then they roll it out and wonder why there's a wall of resistance.
Mm-hmm. Yeah, absolutely.
Awesome. So I'll just quickly summarize. So we talk about rolling ahead without thinking about the consequences, forgetting it's your job to protect and take care of your employees, understanding the logistics and financial costs of any accommodations that you make for people, understanding the impact to the people and their well-being and almost their stress levels, and then not having the right communication to allow people to get bought in. Yeah. Awesome. Laurie, thank you very much. If people want some additional assistance or want to learn more about this, and again, your assistance or some ideas to help them troubleshoot their issue, they can always just reach out to us. Just go to lawrenceandco.com. And Laurie, thank you again.
Yeah, my pleasure.